Hi everyone, welcome back. So following on from my other pregnancy related videos, I'm now today going to be talking about how baby massage can help mums who are struggling with postnatal depression. This is, I think, sort of a slightly newer sort of thought on sort of dealing with depression once you've had a baby. Postnatal depression, it's actually, quite probably more common than a lot of us think. It affects around 70,000 women in the UK every year. So that's roughly about 10 to 15% of women who give birth will go on to develop postnatal depression. Now, around 66% of women experience what we know as the baby blues, which is basically, just feeling a bit down due to the hormones getting back into a regular pattern, and also partly due to just adjusting to those new responsibilities that come with having a baby. But postnatal or postpartum depression is a lot more serious than the baby blues, and it tends to last longer. Certainly if left untreated, it can last for years. So it's really important to address the problem when it arises, so that you can, move on and bond with your baby and enjoy everything that comes with that. So that is certainly one of the big issues of postnatal depression, is that mums will struggle to bond with their baby. They can appear to either be almost indifferent to their baby, or sometimes it goes the other way and they'll be kind of really sort of overly intrusive with their baby. And so the effect of this is that quite often the baby will then cry, probably quite excessively, or alternatively, it can become quite passive and withdrawn, and this can last up to around sort of 18 months old, so quite a long time. There've also been studies that show that if a mum hasn't been given the necessary stimulation in her early years, or early months I should say, then they're more likely to have the same issue when it comes to bonding with their babies. So I suppose from that sort of point of view, there is possibly a bit of a hereditary factor in postnatal depression. Now, while postnatal depression can be treated with psychotherapy or medication, this of course doesn't actually improve the mother-baby interaction and that bonding process. So this is where the use of baby massage can really come in to work alongside those sort of more psychological treatments or medication, to give a good sort of all-round holistic treatment. So in my previous videos, I have spoken about the benefits of postpartum massage. So these benefits obviously included, as with any massage, relaxation and stress reduction. And obviously we know it does this by, it increases the release of the endorphins, those feel-good hormones, such as the serotonin and the dopamine. and it reduces the levels of the stress hormones such as cortisol and norepinephrine, which of course are responsible for that fight or flight response in the body. Pain relief, obviously, even with a normal natural delivery, you're going to have some residual aching from the pregnancy, potentially arm and shoulder pain and tightness, back pain. That could be just from holding baby, it could be from postural changes in pregnancy, it could be from breastfeeding, and just general childcare. So massage, of course, as we know, is a natural muscle relaxant, and particularly for mums who are breastfeeding and they're not keen to take any medication, so massage is really good as a natural pain relief method. One of the other benefits of postpartum massage that we talked about previously is its ability to help regulate the hormones following the pregnancy. So obviously we know that the levels of estrogen and progesterone, which have been really high during the pregnancy, basically will drop suddenly following the delivery, and the prolactin and oxytocin, those levels will rise to facilitate breastfeeding. Obviously sort of postpartum massage can help in that way. And also in terms of, we know that massage has an effect on the circulation. So another benefit is that it helps to reduce swelling. So, we spoke about previously how the fluid volume during pregnancy will increase by about 50%. And so through increasing lymphatic circulation as well as the blood circulation, we're helping to eliminate those, not only the waste products, but also any excess fluid that's built up, particularly around sort of hands and feet, sort of the common areas. And the massage helps move the water in the right direction. And this is further, helped by the hormones regulating themselves back into a normal pattern too. And better sleep, of course. Again, it's those sort of feel-good hormones kicking in, feel-good endorphins, the reduced stress, and then, when we've got less on our mind and our body's not so tense, we're often able to sleep much more easily. But obviously, from the point of view as well, that, the exhaustion from labour, and then the 24-hour baby care, is also, as any new mum knows, gonna, really interfere with your sleeping pattern. But as we know, massage can increase those delta brain waves, which they help to induce sleep. So hopefully means you can get a bit of shut eye while baby's having a nap too. Another benefit that I've actually just posted a video on is improved breastfeeding. So I've done a video on how to do self-breast massage to help encourage milk flow. We know breastfeeding for some mums it is challenging, and it doesn't always come naturally. But through self-massage, we can improve the milk flow, and it also will help to increase those prolactin levels, which is the hormone needed for lactation. It reduces breast milk sodium, and it also will help to relax, the chest and shoulder muscles. Not necessarily the self-breast massage, but in terms of general massage, relaxes those chest and shoulder muscles, which will help you with positioning when breastfeeding. And the breast massage itself can also help, relieve mastitis pain as well. But generally, the benefits of postpartum massage, as we've said previously, it can help to restore your body back to its pre-pregnancy condition, improving the muscle and the skin tone, increasing the lymphatic circulation, to drain any excess fluid that's built up. And it will also help to improve recovery time, whether that be from a natural delivery or from a cesarean section. That effect on the circulation, it brings, additional oxygen and nutrition to the tissues, which, will also help, the muscles get back, to their sort of pre-pregnancy condition, and also to help prevent excess scar formation if you've had a cesarean section, which we know, if you get a lot of scar formation, that can also have an effect on muscle tension in the future. And generally, just assisting with the transition to motherhood, both through reducing the release of those stress hormones, easing muscle tension and helping with sleep so you've got more energy to actually do the things you need to do, and just really generally helping you feel more mentally and physically relaxed. So one of the things we did probably mention in the postpartum video, aromatherapy can also be beneficial in promoting relaxation, assisting with balancing out those hormones, cleansing the body's systems and treating any, anxiety or depression following the delivery. There are a few oils that shouldn't be used if breastfeeding, but, they can always be diffused into the air, as another way of, using those oils. So that's the postpartum massage in general. So how, why is research showing that, actually it's not just postpartum massage that can help with postnatal depression, but actually also doing baby massage, which, we know is becoming increasingly popular in Western society. And there are certainly quite a few studies that are showing that participating in these baby massage classes can really help mums that are suffering with postnatal depression, basically in terms of interacting with their baby better, and just helping with that bonding process that often suffers as a result of the depression. So the baby massage focuses really on 4 main areas. Obviously, as with any massage, relaxation. It's going to help baby relax and sort of help them with sleeping and establishing patterns there. It focuses on stimulation and development of the physiological systems, and also helping to offer relief from symptoms of things like colic, teething pain, any kind of congestion or any sort of emotional stress that baby may be experiencing for whatever reason. But also one of the big focus points is on sort of parent and baby communication, enhancing those skills and that recognition of sort of the baby's non-verbal cues, and how they're responding to things, which can really help with, bonding with that baby. So as we've just briefly touched on, participating in baby massage classes can help parents to focus on their babies without distraction, but to learn about the baby's non-verbal and verbal communication, which enables them then to become more confident in responding to their baby's needs, which in turn will help increase the parents' self-esteem. A lot of parents, particularly certainly with newborns, but particularly with premature babies, parents will worry about how to handle their baby. Because certainly with premature babies, they may initially find it quite difficult to be touched, but through doing baby massage, not only does this help gradually sort of help the baby feel more comfortable with that physical touch, but it will also help sort of instill a bit more confidence in the parents in handling that baby. And by observing the baby's body language, that will also assist with the handling process. So recognizing things, for example, like if the baby has fingers sort of splayed out, or sort of unsynchronized punching movements, it will enable the parent to recognize that this could actually be an indication that the baby doesn't want massage at that time, or doesn't want to be held at that time. And so understanding these sort of aspects of body language can really help with parent-baby bonding. But certainly for baby massage, there are benefits both for the baby and for the mum, or even dads. A lot of dads do post baby massage classes. So for baby, the benefits we're looking at, as we said, it can be very relaxing for the baby, and so we're looking then at better sleeping patterns, helping the baby to get into a regular habit with regards to their sleep, which in turn means good news for you parents, because hopefully then you won't be up half the night and you'll be able to get a bit of sleep yourselves. Also, in terms of improved neuropsychological development of the baby massage will help with that. Relief, as we said, from things such as colic or constipation, baby massage will really help. And also weight gain, just helping them generally develop and feed well and do everything that they should be doing. But for mums with postnatal depression, there's actually also benefits of massaging their baby. So as we've said, it's understanding the body language, which will help you with that early mother-baby interaction, understanding your baby's responses to things, so that you can basically better meet their needs, because you'll know what it is that they're trying to tell you. Massage also increases oxytocin. Now that's not only when you're receiving a massage, but actually it's been shown that giving a massage can also help release oxytocin, which of course is that feel-good endorphin. It's that kind of love and caring hormone, and this is going to promote again maternal behaviour and just improve that bonding with the baby. So sort of by helping mums to recognise these non-verbal indicators and helping mums cope with what may be difficult circumstances in a more positive frame of mind, it can really be very reassuring to mums in terms of learning how to care for their baby, learning how to cope, either when they've left hospital early, or if they're, maybe they've been isolated in intensive care units, if the baby's been premature. And just giving them that confidence, to go ahead and be a mum. And I think in terms of sort of participating in classes as well, it's also a way that new mums can access other services, and get advice and information, if sort of other little problems arise along the way. It has also been shown that if baby massage is combined with music therapy, that this can actually change the EEG patterns of depressed mums. So that's basically, it has an effect on the brain waves, which, will then help, sort of promote a more positive mood, in the mum. So, so although the massage is actually being done on baby, there's still benefits certainly for the mum. Also, when we're talking about non-verbal, recognising those non-verbal cues from baby, and enabling the mum to respond to these cues instead of, sometimes they might maybe cover up their difficulty in sort of understanding what their baby wants, and they may sort of cover it up by sort of constantly sort of trying to feed the baby, or just constant caregiving. And sometimes it may just be that baby wants to be left alone for a bit. And it also helps mums with maintaining eye contact with their baby, which again, if they're depressed, this actually can be quite difficult. But if they're able to, do this more, again, it helps with that bonding process. So, through recognising that the baby may be hypersensitive to a particular touch, or that their baby may want to rest rather than, being held all the time, or constant feeding, by recognising, these signals, it just helps mum to understand that it's not a case of, my baby doesn't like me and it keeps crying, and it just helps mum to not take baby's crying and sort of maybe inability to sort of settle, to not see that as a rejection, and to not see that as a failure of her abilities as a mum. So just helping this sort of mutual understanding between mother and baby can really go a long way. So I guess the question is, can baby massage help to overcome postnatal depression? Well, there's very little evidence, that baby massage actually aids with the recovery of postnatal depression. But as we've said, it can certainly improve with the bonding process, which is often difficult for those suffering from postnatal depression. And as I've said, so this is why it's not a sort of standalone treatment. It's something that should be used in conjunction with medication or psychotherapy, because massage will work on that bonding process and the communication skills that the psychotherapy and medication won't work on. So they complement each other. But yeah, through improving this bonding process, and through enhancing this communication between mother and baby, what mums will often find is that those sort of basic care tasks, will start to feel a bit more pleasurable, rather than feeling like, a chore. So things like feeding and bedtime routines. And this will really help boost, the mum's confidence in looking after her baby. This can, then lead to reduced stress, and improved sleep, not only, as we said, for baby, but also if baby's getting more sleep, then hopefully that means that, the parents are getting more sleep, which then obviously allows them to deal with parenthood, more efficiently the next day. So the communication and recognition of these non-verbal cues, which can be missed by a parent who has postnatal depression. It will improve awareness of what your baby needs, what they're trying to tell you, and this consequently improves your mental well-being as a parent by helping you sort of look at yourself a bit more and notice signs in yourself of depression. And when you recognize that and start to work on that, this in turn will then also help your baby to respond to you even more. And so it's a sort of a self, one thing sort of leads to another, and before you know it, the whole situation is looking a lot more positive. We know, as we said, massage helps stimulate release of oxytocin, not only in the baby, but also just the act of giving a massage helps with oxytocin release in your body, which will promote bonding again and just help lift your mood. And as I think I said also earlier, attending a group class, helping you to meet other mums who maybe are in the same situation, and realising, that you're not on your own with this. It's very easy with any depression to feel like you're the only one going through it. If the group sort of setting feels a bit too much to start with and you feel a bit self-conscious, find a therapist who will do individual lessons just to help you initially feel a little more comfortable, in sort of communicating with your baby and massaging your baby, before you sort of participate in that group setting. But as always, the biggest thing is, as with, any sort of serious depression, do seek advice and help from either your GP or your health visitor. That's what they're there for. Yeah, as I've said, the massage is certainly going to help. It's not a standalone treatment. So, quite often you do need that early intervention, whether it's from medication or psychotherapy or just sometimes a little extra support. You do need that early intervention, to avoid sort of it going on for years, which can really obviously then affect your relationship with your child. So that is how baby massage can help with postnatal depression. As always, feel free to comment, feel free to subscribe, and you'll be notified of further videos. you can contact me through my Facebook or Instagram, and I'll do my best to give you advice or answer any questions. But for now, that is all from me. So there will be more videos to come, and I will see you next time. Bye.